Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE OTWA Community Action Partnership, and Lakeside Sports and Pain Clinic.
We're back at MAHUBE OTWA today, and one of the reasons I love coming to MAHUBE OTWA is because they provide such essential services here in the Lakes area. And today we're talking with Chandler, and she specializes in health and family services at MAHUBE OTWA. So what is it that your role provides here at MAHUBE OTWA?
Yeah, so I work for Family Health here, and we are a reproductive health program. So we provide subsidized reproductive health services at our 4 permanent clinic locations in Detroit Lakes, Perham, Fergus Falls, and Wadena, and then also at satellite locations in Long Prairie, Pine River, and Morris. And
what are some of the services that you might provide for someone that comes in?
Yeah, so our common services include things like birth control provision, pregnancy testing and counseling, STI testing and treatment, and then we also do different vaccinations like Gardasil, and we do also test and refer for HIV and Hep C testing as well.
Sure, and the cost for some of those things?
So everything is based on a sliding fee scale. We do take all different kinds of insurance plans, both public and private. We have a few funding streams that are available to folks, but we never turn anyone away based on an inability to pay. So for a lot of people, especially if you're low income, your services will be free or low cost.
Great. So if you were looking to use some of those services, what's the best way? Do you just come in, or should you call, go to a website?
Yeah, so the best way is to always schedule an appointment. We do take walk-ins, but only for select services. So your best bet is always to call. We have a 1-800 number. It's 1-877-275-6123.
One of the things that I've been hearing about recently, at least in the last 5 to 10 years, is this HPV. And that's something that you guys are dealing with here a lot too, isn't it?
Yeah, so we've been really focusing on educating our clients and providers on HPV and the HPV vaccine, which is Gardasil. The CDC has come out with some new recommendations, and those include the idea of this 2x12. So they're encouraging young people between ages 9 and 12 to get the 2 doses of the HPV vaccine before age 12, because after age 12 you actually have to get 3 doses of the vaccine.
So what is HPV?
Yeah, so HPV is a disease that is transferred through, sexual contact, but it's very, very, very common. In fact, the CDC estimates that anybody not vaccinated against HPV will get it at some point in their lifetime.
Wow.
So, yeah, that's a huge, startling statistic. And so the HPV vaccine protects against the 9 most common forms of HPV, which protect against the cancers that HPV is known to cause, and some of the diseases that it's known to cause as well.
So does this affect both men and women?
It does. It's very interesting because there's no testing that can be done for men to know whether or not you have it, but men are the most common people who pass it along because of that, right?
Sure.
But yeah, it is common in both men and women.
Okay, and then HPV, I think you mentioned, is a cancer-causing disease?
It is, yeah. So it causes different kinds of cancer. Cervical cancer is one of the most common. Actually, I believe that cervical cancer is almost exclusively caused by HPV. And then there are some really disfiguring mouth cancers that can be caused by HPV as well. And so we've seen a huge increase in that recently in the United States. And so there's a lot of education going around to make sure that young people are getting vaccinated before they ever have the opportunity to be exposed, so that their bodies can fight off that infection if it were to ever, happen.
Interesting. Those are some shocking statistics. I guess I didn't realize that HPV was as prevalent, and that likely we were all to get it without the vaccination. So what does does the vaccination actually prevent the cancer?
Yeah, so it protects against the 9 most common strains. So if you get the vaccination, then you are protected against those 9 strains. And the CDC does also recommend that, if you are in your 20s, it's recommended for up to age 25 currently, and you may have been exposed to HPV at some point in your life, you can still get the vaccination and be protected against the other forms that you have not been exposed to.
So does MAHUBE OTWA, do you provide the testing and then also the vaccination?
So the testing is not very common. A lot of times it's when you have a pap smear or something like that. That's how you would find out if you had been exposed to HPV. So regular pap smears, yes, we would do that. But we do also provide the vaccine, and we recommend that to all of our patients.
So the vaccine is really a preventative measure, like the chickenpox vaccine and some of the other things that were standardized now that we're just getting.
Absolutely. And there's a lot of patient and provider education going on to make the HPV vaccine as prevalent as, measles and mumps and all of that. And so we're really trying to just educate people that it's just like any other vaccine that you would get routinely, and it really is about cancer prevention. And I think most people, if they knew that they could do something that could prevent cancer in either themselves or their children, they would want to take those steps.
Sure. Well, this has been really informative. Had no idea that HPV was so prevalent. Really had no idea that basically all of us were susceptible to HPV, and without that vaccination would likely contract it. So thank you so much for your time today. And if you're looking for more information, MAHUBE OTWA has the website, which is...
Yep, it's www.familyplanningcentralmn.org.
You can also call that 1-800 number as well, or just stop into any of the locations. So thank you so much, Chandler, for taking some time today.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE OTWA Community Action Partnership, and Lakeside Sports and Pain Clinic.